We probably house and care for and support almost everybody that you can think of. So we're a general needs housing provider, but we also have mother and baby units, domestic abuse schemes, older person schemes. We've always just tried to respond to what the need is in the area that we live in.
What have been some of the biggest challenges that come with having such a broad customer base?
I think the biggest challenge we have is in managing teams, really diverse teams across the whole of the county.
What are some of the positives and some of the benefits that you've seen from having such a diversity of customer?
Because of the diversity of customers we've got, the insight from them means that we're able to use that across the whole of the business. The number of things that we have to do as a landlord now, I think, are just so much greater.
Wendy, welcome to the podcast.
Hi, thank you. Thank you for inviting me.
No problem. And as always, I like to start. Do you mind just by giving us just an introduction to yourself and your organisation, Wendy?
Yeah, well, I'm Wendy Evans-Hendrick. I've been a Chief Executive of Orwell now for about 7 years, but have been at the organisation in total for, it will be 31 years in March. Joined as development manager, worked way through development property services, and was fortunate 7 years ago to be appointed as chief executive. I mean, Orwell is a traditional rural housing association. So we were created in 1963, head office in Ipswich in Suffolk, and we've got housing stock across the whole of the county of Suffolk, into southern Norfolk, a little bit into Essex, but we don't really go any further than that. So we're quite clear about our boundary really is those three areas. We've got one scheme in Cambridge, which we inherited, but that's all. Diversified as an organisation about 25 years ago into also providing care and support to customers. And I always say, if I tried to sort of explain who we housed, we probably house and care for and support almost everybody that you can think of. So we're a general needs housing provider, but we also have mother and baby units, domestic abuse schemes, older person schemes, learning disabilities, mental ill health, young homelessness, direct access hostels, almost everything. We're almost, and part of that is because I think because we're a very community-based organisation, we've always just tried to respond to what the need is in the area that we live in, if you like, and trying to be responsive to that community. And hence, over that 60 odd years, it's kind of grown into this real melting pot of everything, really, which makes it wonderful.
Love it. I mean, I know we talked a bit about this offline, but just, for the audience, like, what was the process of becoming an organisation that wanted to support such a diverse customer base and have such a diverse portfolio? Because it's not the easiest path, certainly. And so what was the process that you went through, and why was it that you decided you wanted to support such a diverse portfolio? I mean,
it started off really with us being the developer for a number of supported housing. So we worked very closely with both Suffolk and Norfolk county councils at the time, as I say, about 25 years ago, and we were the developer for those various supported housing schemes, and we ended up being the owner of those supported housing schemes, but maybe with different care providers or different support providers in them. And we still have some properties like that now, where we're not necessarily the support provider for all of our properties. And then we were actually approached by the commissioners to say, look, actually, you're so good at the work you're doing in the development team, being inclusive and involving people in terms of that design. We're really struggling to find a support provider to initially look after a couple of schemes for people with learning disabilities. And would we be prepared to step in and do that on this smaller basis, which we did. And it then moved into older people. We already owned the women's refuges, but there was another provider in there. That provider went under, so we stepped in and took it over ourselves. And I think it's once you realise what you can do, and that actually the service that you can provide, because you are the landlord as well as the support provider, the seamless service that you can provide, it's really powerful. And, we realised that actually what we were able to do was to provide a better service really for all of those customers by being involved on all aspects. So it wasn't necessarily a planned move, I would say. I think it was something that happened by default. It's something that happened, I think, because we are a community-based organisation working with our local stakeholders. We're asked to step in and help. did that, and then it just kind of grew, really.
And was it like a natural evolution? How have you become sort of the Orwell housing of today, I suppose? Was it just a natural evolution from one thing led to another, or did it become part of your ingrained strategy that you wanted to help as many diverse groups of people as you can?
Initially, it felt as if it was it was a bit of a natural step. But then it does take over. And actually, when I took over as chief exec 7 years ago, I think for a number of years, we'd really struggled we kept saying Orwell are different, but we really struggled to define how and why we were different. So we did a piece of work 7 years ago to say, come on, look, let's actually recognise the reason we're different is because basically care and support is at the heart of what we do. And it now kind of bleeds out across everything we do as a housing association. So, our general needs tenants, I think, in terms of we all see, and I think a number of people probably on your podcast have talked about, the changing needs of all of our customers and our tenants, and the higher level of mental health pressures and all sorts of things that we're seeing in our general needs stock. Because we're already in that support and care place, if you like, it's meant that we're able to respond and bring in with those, in our general needs stock, a level of tenancy sustainment and advice, domestic abuse, because we're already domestic abuse providers. We already have our own various accommodations. The domestic abuse team is able to provide that advice and input to, general needs housing officers, for example. So it does actually spread across the whole organisation now. So it is part of our culture and our ethos and our values really now.
And to ask the question, what is the split between care and support and general housing needs? Do you know, like roughly, is there a lot in terms of care and support and less in general housing needs, or is it a nice blend?
No, I mean, in terms of housing stock, we will still have more general needs housing stock than we've got care and support. In terms of staff numbers, that's completely the opposite. So we have nearly 800 members of staff.
Yeah.
About 180 of them are employed, if you like it, as on the landlord side of the business, and obviously the vast majority of those will be providing some level of care and support. But yeah, the majority of our housing stock is still general needs.
Okay. And what have you found the biggest challenges? I'm sure they're constantly coming because the needs are constantly evolving as well. But what have been some of the biggest challenges that come with having such a broad customer base? When I did the research, I mean, it really is diverse, but what have been some of the big challenges that you've had to face and overcome?
Although the diversity brings challenges, it also brings some kind of robustness, because of course we're not an out and out older person's care and support provider. So we're not entirely vulnerable to changes in, older person's care. So it does give you a strength, if you like, within that diversity. I think the biggest challenge we have probably is in people, in managing teams, really diverse teams across the whole of the county. And interestingly, a lot of the things that we struggle with is, whereas another housing association, if you're a general needs housing association, you can make a decision about your staff team, can't you, as a whole? That is really difficult for organisations who have care and support, because, even simple things like, shall we close early for Christmas Eve, which most associations probably, say, yes, we'll close at 12 o'clock on Christmas Eve, whatever it is. For us, that's a really fundamental decision, because I've got 400 people who still need to work 24 hours a day all the way through Christmas.
Of course, yeah.
And so kind of balancing that, what's fair and equitable, and trying to be one organisation, because I think that was really important for us. We wanted to be one Orwell. We didn't want to have care and support over here, general needs over here. So you spend quite a lot of time trying to kind of somehow compromise between the two, and we don't always get it right, but we do try.
Yeah, and I was going to ask actually about skills, because needs have become more diverse, and as we get more educated on certain needs, how has that worked in terms of your team internally? Have you had to upskill people? Have you had to, create different roles to deal with different groups? I mean, how's that worked from a skills and talent perspective from your organisation?
I think the general needs side of the business just benefit from the knowledge that they can get from their supported housing colleagues on those specialist skills. I think the biggest frustration that I have really is the lack of value that us as a country put on care and support skills. And you see that by the price that people, the salaries that go alongside care and support services. And yet actually it's a hugely complicated and responsible job, and I always say, would you want to be cared for by an unskilled care worker? Well, of course you wouldn't. You want your family and your parents to get the highest level of skill possible. And yet those people will earn more if they're sat on the tills in Tesco's. And so that to me is the biggest frustration, I think, is that, and that's us as a society really not valuing and providing a professionalisation to people who work in care and support when they do a phenomenal job that most of us wouldn't have the skills to do.
And it's a very, very difficult job, right?
Yeah.
It's one of the most difficult jobs there is. And we've recruited previously in that area. And it's so difficult because it's such a hard job, so lowly paid, and it's not caught up with the cost of living, unfortunately, at all.
No, absolutely not.
And I'm sure there'll be people out there who'll say we should stop supporting certain customer groups. But kind of, have you ever discussed that? I mean, does that happen internally? Is that a discussion that goes on? Because I hear that quite a lot, and I wonder, does that ever happen as a discussion?
Yeah, I mean, certainly we have a principle so that we recognise that first and foremost, we're a housing association.
Yeah, of course.
So we shouldn't use housing assets or housing income to subsidise care and support. And the principle of that is because if we are, then we're taking money away from our tenancy customers to do that. And actually, care and support should be paid for by the state or by the private payer if that's what they need. So we work really hard to make sure that there isn't a bleed, if you like, of finances from the main housing association business into our care and support business. And I think that fundamentally is very important. So that means we do have to have really difficult discussions sometimes when you've got, we all know the pressures that are on the social care sector. We've just heard that they're going to do another review that's going to take till 2028. So it's not going to be resolved soon. So we are in a position now where with the national insurance increase that is directly affects care and support, directly affects all employers, but care and support providers, that if we don't get that increase recognised in fee increases from the county council, then we will have decisions to make as to whether we can afford to stay in providing that care. And that's fundamentally really where those discussions happen. It's about finance, sadly. We know the quality of care and support that we provide. We're not prepared to compromise that because obviously the reason we went into it was to be able to provide our customers with that high level of care and support. If we feel that financially we can't afford to do that, we're not going to take money from, the repairs budget to prop up because we can't afford to, and it's not that we do. And actually, that those costs should be paid for by the state, appropriately paying the true cost of care. So we have those conversations all the time because every year there'll be one scheme that will be struggling. But we usually try and, we usually resolve it and work through. But I am really concerned about how we're going to do that with the national insurance increase. Because, the national insurance increase with one fell swoop put £625,000 of costs on our care and support business. We've got nowhere to go for that money. We're not Tesco's. We can't put our prices up, willy-nilly. Most of our funders, because of the sector we work in, most of our customers rely on their care costs being paid for by the government, by the county council. And so, unless there is a flow through from that money, where do we get that money from? So it's probably the most worried I've ever been, I would say, now.
And I'm sure the sector's worried, right? Because as you've said rightly, general needs housing doesn't need as much staff as care and support does. So clearly the NI burden is going to be much greater on a care and support provider than it is on a general housing needs. So I've never actually thought of that context, which is really interesting and also quite worrying, because then what happens if you stop taking on people that you should be taking on and caring for those people? And that's when we get this like people falling through the cracks and homelessness, and it's worrying, isn't it? It's like a spiral of problems that keep seeing sort of happening. And I suppose we talked about kind of some of the challenges, and I never like to do that without thinking about some of the benefits. But with such diversity of customer base, what are some of the positives and some of the benefits that you've seen from having such a diversity of customer?
Well, I think hugely sort of, there's a whole discussion, isn't there, in the sector now about customer insight and how do you use customer insight to drive your business. Because of the diversity of customers we've got, that the insight from them means that we're able to use that across the whole of the business. So, the insight that we've got in caring for older people in our extra care services means that we can use that to look appropriately as to how we can better support older people who are living in our general needs stock, for example, because not all old people, opt to move into a care setting. So, as I say, the cross-fertilisation of views and ideas is huge. Really, really helps, I think, make us a much more knowledgeable and rich organisation.
Yeah, nice. And we've talked about some of this already, but just more generally for Orwell, you've obviously been in the same situation as every other housing association, but how have you managed to overcome some of the challenges that the sector is facing today? Like, what have been some of the things that have been a challenge, and how have you sort of come over them over the last, certainly the last 7 years as chief executive, but what have been some of the things that have been difficult and how have you overcome them?
Yeah, it's interesting. I speak to some other colleagues who've been chief exec for similar, a lot of us in the East sort of became chief execs at a similar point in time. And we always joke that the last 7 years have probably been the hardest for being a chief exec than prior to us taking over. And it certainly feels that way. I think the impact of the 4 years of -1 rent increases that we had are really being felt now, post-COVID and all of those things with costs going up, staff shortages on maintenance, all of that kind of thing. We really struggled along with a lot of people in just catching up and keeping up with our day-to-day repairs service. And we went really, I suppose, pre-COVID from having a fantastic in-house repairs service where we were completing all of our repairs, both, even routine within 21 days, to now we're just, we really are still struggling to stay within sort of we've had to sort of go back in time, I would say. We've had to take a step back to the more traditional, emergency routine and longer term repairs in order to be able to just cope with that, with the demand on the service. So we've got a growing demand on the repairs service with a shortage of good qualified technicians to carry out. And as I say, I know we're not alone. I hear this, I hear this across the sector, but it is really sad and frustrating that you think, well, actually, what can we do and how can we how can we bring that back to where we were? As I say, 2019, prior to the pandemic, it can't all be the pandemic, but it does feel as if, beyond that, the demand for, our demand for our repair service is far, far higher than it ever was before.
Why is that? Because honestly, I think if I was to say I've done 100 podcasts, I'd say 80 of them have talked about the ever-growing expectation of customers and also the diversity of repairs, weirdly. There's just so much now. But why? What has happened? Why is it gone so far backwards, would you say?
I don't know, really. I think, I know a number of the people, the journalists will say it's because of lack of investment in the housing stock previously, but I genuinely wouldn't say that is the case as far as Orwell's concerned. We didn't ever cut back. When we did the 4 years of -1, we didn't cut back on programme works. We found the money elsewhere. So, but it does seem to be a growing demand, really, from our perspective. I do think compliance, if you think back historically, if I think back to probably before you were born, 30 odd years ago, gas safety had only just come in. The laws about having a gas boiler service was the only thing that we had. I now have a whole team of people employed just dealing with compliance, gas, Legionella, electric, all of the things now that we, quite rightly have to do, but all are coming out of that same rent pot, aren't they? The rents haven't gone up by the same proportion. So even if you just chunk it up, the number of things that we have to do as a landlord now, I think are just so much so much greater. And obviously our rents are lower, and proportionally lower because they went down for 4 years. We then had the rent cap post COVID. I know there's been we're in the rent consultation period at the moment, or that closed just before Christmas, looking at, and I know a number of us have made proposals to bring back convergence so that we can bring a bit more money back in. I think it's lots of little things that have just, grown into a much, much bigger problem that I think you just feel as if we could just get ahead of it, you could get it back to normal again. And it's just that, how do you get ahead of it?
Yeah, and I do think I've spoken to someone else about this recently. I think one of the bigger things as well is we've become quite instantaneous with everything, right? Mobile phones at our fingertips, the expectation that if you order something today, it's here tomorrow. There's all that kind of mentality thing as well, isn't there? That everyone wants everything tomorrow as quickly as possible at the highest quality. And the budget doesn't necessarily stretch to that, does it? That's the reality.
No, I mean, that is absolutely the reality. I think generally, we all have expectations, don't we? If you think about it, you send someone an email and you expect the reply within the next, 2 minutes kind of thing. Whereas actually, if you'd have sent them a letter, it would have taken, 10 days before the whole process would have come round. So I think that the kind of pace is there, and the expectation is there on customer services. But yeah, if you think about proportionally what the rent of that house would have been, 20 years ago, and it's only ever gone up by inflation, and in fact, in some years has come down by inflation, the costs have gone up, but your income's has just not tracked it. So we're trying to all deliver to a much faster, more responsive customer service. Yeah, with smaller resources, I think in some cases.
Yeah, no, it's a good point. And as we kind of wrap up, what have been some of the biggest changes at Orwell, and what have been some of the biggest changes in the sector that you've seen, I suppose, in that time?
Yeah, I mean, I think the pace of change. I think speed.
Right.
I would say, if I think back all those years ago, we seem to have more time. I'm sure we probably felt as if we didn't.
Yeah.
But, if I think back to, the conferences that we all used to go to, I think there was more collaboration then. Actually, was more working with local authorities. I mean, we work quite hard in the east of England, and we do collaborate and work hard together. We've got Independent East, which is a group of 5 associations in the East who all work together and work quite closely. But I think that there used to be a lot more of that went on historically, particularly local authority partners. And I think there's less of that now. I think we're all a bit more insular. Having said that, though, if you look on the development side, we were all a lot more competitive in those days, whereas I think now there is I think there's just an acceptance that actually none of us are ever going to be able to solve the housing crisis on our own. So there's more than enough development opportunities out there for all of us, kind of thing. So I think that feels as if that's all sort of calmed down, really. But I suppose I feel now that there are more internal pressures within housing associations rather than external pressures. So if I think back, our whole emphasis in the past used to be about we were okay. We didn't need to, Orwell was fine. It was ticking along. So it was all about what could we do? How can we impact externally? I spend a lot of time now thinking, okay, internally, what have I got to do? How am I going to resolve the repairs issue? How am I going to resolve, care and support issue? And it feels like there's a lot more kind of internal stuff. And I suppose that if you think about the number of associations that are V2 now, there's probably more V2 organisations out there than there are V1. Well, that never used to be the case. And so I think, that whole pressure of managing the budget, keeping an eye on all of that stuff wasn't there in the past. Economically, we were all very, very comfortable and could therefore really focus on sorting out external stuff. Whereas I think there's an awful lot of managing your own organisation, if you like, within the budgets that you've got in order to continue to do those things, It's
interesting, isn't it? And every time I ask that question or when I've asked it previously, it's like these things go in cycles, don't they? Like you've just said about development, it's like it feels like we come back on ourselves like 10-year cycles almost. But and what are you excited for Orwell in the future? Kind of like what are you looking forward to in the next 3, 4, 5 years? Because like you say, it's been a tough 4 or 5 years in our sector, I believe, like since 2020, I'd say. But like, what are you now looking forward to as you look at the horizon? Kind of, what are the things that you're looking forward to for Orwell?
I think there's some real good growth opportunities out there. I mean, I am excited and pleased to see the government's commitment to housing. It would be great to see a long-term plan for housing, and it's great to see that housing is top of, it's consistently being talked about at government level.
That's true.
And for a long time, it was completely silent. And for a long time, actually, we were for the first time, ever, housing associations were sort of, weren't very popular with the government, were we? And I think that feels as if that's changed again, which is great, that we're seen as part of the solution. And so I think there is a real opportunity to work with government, with our local authority partners to really get stuck into sort of, helping to solve the housing crisis, because I mean, it's a huge task out there. The levels of homelessness and housing need is, it never goes away, does it? I mean, that's the sad
and it's
thing.
Not going
I
to.
think in my 30 years, we've never met it, and it feels as if we're further away from it than ever at the moment. So it's really good news, I think, that hopefully the capital funding is going to be there to enable housing growth.
And I totally agree with that. And I think that even though there's real positive signs, like you say, it's going to be really difficult now to meet the demand. I mean, however much development we do, it's still going to fall short of what's actually needed in the country, isn't it? So we're going to have to be building for 20 years consistently and have a long-term plan for the sector, which hopefully we'll get now, but we need a longer-term plan. It needs to be 20 years. We need 30-year business plans, and we can't even see 12 months ahead of what the budget's going to be. So.
No, and that's part of the problem, isn't it, with 5-year parliaments, really, is that, unless you get that cross-party agreement that things aren't going to change, how do you get that future vision, really? But I'm sure everyone feels that about all of their sectors. So
yeah, I'm sure they do, and that wraps us up really nicely. I just wanted to say a massive thank you. I mean, I'm sure you are already, but you should be really proud of the organisation. And 30 years in one business, it's very rare that we see that now. I would say, and it sounds like you've consistently evolved the journey for the business, but also yourself and your career. So, but I appreciate your insights, and I'm sure that's going to be really useful for people that are struggling with some of especially the care and support challenges. Like, every organisation's talking about the same thing, and I don't think anyone's got the answer right now, have they?
No, and I think that's why it's really great if we continue to talk to one another, because we can all share from one another. There'll always be some organisation that could give you one little tidbit that would just help. So, that the ability, and some of these things like these podcasts and stuff like that enables us, I think, as a sector, which is really great to just hear from a range of different voices.
100%.
And if you can just take away one tiny little nugget of something that helps, then I'm all for that. I'd love to nick an idea and improve something. I'm all for that.
I'm sure everyone's the same. But thank you for your time, Wendy, and appreciate you coming on the podcast.
No worries. Thanks very much.
Thank you. Cheers.
Thank you for listening to another episode of The Hip. If you'd like to hear more from us, please be sure to follow us on your favourite podcast platform. We are also running a 30-minute clinic free of charge to any clients that want to recruit in a more inclusive way. For more information, please reach out to us on our website, andersonjames.com.